This is DW News live from Berlin. An historic step in the fight against malaria.
This long-awaited malaria vaccine is a breakthrough for science, child health, and malaria control.
The World Health Organization approves the first vaccine against malaria. It's been 30 years in the making and could save thousands of lives, especially in Africa. Also coming up, Germany moves closer to forming a new government. Talks are going to the next level between election winner, the Social Democrats, and two smaller parties, the Greens and the Free Democrats. And from danger in Afghanistan to safety in France, we visit the Parisian bar that's become a refuge for those escaping the Taliban and other authoritarian regimes. Hello there, I'm Raheela Mahomed. The World Health Organization has approved the first ever vaccine against malaria and recommended it be given to children at risk in Africa. After more than 3 decades of development and trials, it's a significant step in efforts to eliminate the disease, which is caused by parasites and spread by mosquitoes. Malaria claims hundreds of thousands of lives every year, mostly children under 5 in sub-Saharan Africa.
A chance at life. That's what this vaccine means for thousands of children across sub-Saharan Africa. After 30 years in the making, Mosquirix has been approved and the WHO is urging vaccinations to start for at-risk children immediately.
We've long hoped for an effective malaria vaccine, and now for the first time ever, we have such a vaccine recommended for widespread use. Today's recommendation therefore offers a glimmer of hope for the continent. We expect many more African children will be protected from malaria and grow into healthy and productive adults.
The shot is a historic breakthrough. Although not perfect, the vaccine is only 29% effective at preventing severe disease, and it requires 4 doses to be administered. But studies estimate it will prevent tens of thousands of deaths in children under 5 each year. It also has another benefit: ease of distribution. Other malaria prevention measures, like distributing mosquito nets, took years to implement. But the jab is included among routine immunizations, making it easy to roll out. After decades of research, finally, a vaccine that will help turn the tide on this deadly disease.
Ashley Birkett heads malaria programs at PATH, a non-profit organization focused on global health. He joins us now from Seattle in the United States. It's great to have you with us on DW News. How significant is this move by the WHO?
Well, actually, very significant. It really is a historic day in our efforts to reduce the disease and death from malaria in young African children. We've seen really a stalling of progress in our efforts to suppress malaria, particularly over the last 5 years. So after about 15 years of success in reducing the deaths from over 1 million per year to under 500,000, we've really seen a plateau of the last 5 years, with about 250,000 African children continuing to die every year from this disease, despite our best efforts with the tools that we have available. So it's really a welcome addition to have an additional new tool to help with this fight.
Why has it been so difficult to get a malaria vaccine until now?
Well, several reasons for that. First of all, it's caused by a parasite, which is a very difficult entity to protect against with a vaccine. We've historically been very effective at developing vaccines against bacteria and against viruses, but this would be the first vaccine in widespread use against a parasite. And I think secondly, this is really a disease of some of the poorest people in the world. And just the drive to develop a vaccine has not been the same as we see for diseases that affect wealthier nations like COVID. So it's taken a long time and a lot of effort, but it's fantastic news to hear the WHO recommendation today.
Well, as mentioned, Africa accounts for most of the malaria cases. Do you think that it might be quite difficult to fund vaccines for malaria? As we've seen with COVID-19, there is a lack of equity for distribution.
Absolutely. I think this is the next concern ahead of us. We'll take today to celebrate this news, but really additional resources are going to be needed to bring a vaccine or other new tools to the fight against malaria. No single tool alone is going to win the battle against malaria. It's really about layered interventions, multiple tools layered on top of each other. So as we innovate and bring new tools like vaccines to bear against malaria, we're going to need new resources to help win the battle. So really that's the next critical step, is bringing new resources to the fight so we can ensure that every child that could benefit from this vaccine has access to it.
And how quickly do you think this will be distributed?
Well, right now, the vaccine is being deployed in 3 countries, in Kenya, Malawi, and Ghana, as part of a WHO-led pilot introduction. That generated a lot of the information that was important for today's deliberations. But really, it's going to take those additional resources now as we think about expanding within those countries, and then eventually adding more countries to the fight. But tens of millions of children could benefit from this vaccine. So it's going to require investment to both buy the vaccine, but also to ramp up the production so that we're manufacturing it at the scales that we need to protect all the children that need this across Africa.
OK, Ashley Birkett, head of malaria programs at PATH, a non-profit organisation that focuses on global health and also helped fund the development of that vaccine. Thank you very much for your time.
Thank you.
This is DW News, live from Berlin. Stick around for our documentary on the great apes. And there's plenty more for you on the website, dw.com. I'm Raheela Mahomed. Bye for now.